Whether you are warming up, landing a jump, or just walking across the room, your knees are working hard behind the scenes. They're central to almost every movement we make. But what actually makes up the knee, and how does it all stay connected and functional? Welcome to the Ballet Science Podcast, where we bring science into the studio to help dancers of all ages and abilities give their best performance both on stage and off, and reveal how the science of ballet is beneficial for everyone who moves. I'm Caroline Simpkins, a former ballerina turned researcher, and today we are zooming in on one of the most hardworking and vulnerable joints in a dancer's body, the knee joint. Let's start with the basics, specifically the bones that make up the knee. The knee joint is made up of three bones: the femur, which is your thigh bone, the tibia, which is your shin bone, and then the patella, which you can see inside here, which is better known as your kneecap. The femur is the heavyweight here, literally. It's the largest and strongest bone in your body, running from your hip all the way down to your knee. The lower end of the femur has two rounded surfaces called condyles that connect with the top of your tibia to form a hinge-like joint. Next, we have the tibia, or the shin bone. It's the larger of the two bones in your lower leg and sits right underneath the femur. The top of the tibia is called the tibial plateau, and it acts like a supportive shelf that receives the femur. It carries most of your body weight below the knee and plays a big role in maintaining proper alignment. Then we have the patella, or the kneecap, which is inside here. This small triangular bone doesn't connect to other bones, quite like the femur and tibia do. So instead, it floats within the tendon of your quadriceps, which is your front thigh muscle, sliding up and down over a groove in the femur when you bend or straighten your knee. Think of it as a mobile shield. It protects the joint and gives your quads a mechanical advantage when you extend or stretch the knee. Now, nestled between the femur and the tibia are two essential pads of cartilage called the menisci, which are these blue things here and here. You've got a medial meniscus on the inside and then a lateral meniscus on the outside. These crescent-shaped structures act like shock absorbers. They help distribute weight, stabilize the joint, and cushion it from impact. In movement-heavy activities, especially ones that involve jumping, twisting, or landing, like in dance or sports, these menisci are critical. They help prevent the bones from grinding together and reduce stress on the overall knee joint. But the menisci in the knee are also vulnerable. The medial meniscus tends to be most commonly injured, especially in movements that involve rotation while the foot is planted. This can happen during a misaligned landing, an off-balance turn, or even a deep squat where the thigh bone rotates but the shin doesn't follow. When this happens, you can end up with a torn meniscus, something that can lead to pain, clicking, or even the knee locking up. So protecting these menisci and the knee overall starts with a few key things: proper alignment of the legs, good control when landing or changing direction, and strong coordination between the hips, the knees, and the feet. When the surrounding muscles are doing their job well, your knees are far less likely to get overloaded. So why does all this matter, whether you're dancing, running, or just moving through daily life? Let's use a movement example. Imagine you're doing a deep squat or a grand plié. If your hips, thighs, and feet are working together properly, your femur or thigh bone will rotate in the hip socket, your tibia or shin bone will stay aligned with your foot, and your patella or kneecap will glide smoothly within its groove. But if something's off, say your femur or thigh bone turns inward while your shin stays still, that creates rotational stress on the knee. And here's the thing. The knee isn't built to rotate like that. It is a hinge joint, meaning it moves this way, and not a ball and socket joint like your hip. Forced out of alignment, especially during high-impact moves, the knee's cartilage, ligaments, and menisci end up absorbing the stress. Over time, this can lead to pain, instability, or even injury. That's why proper technique and alignment matter so much. It's not just about aesthetics. It's about long-term joint health. Now, a quick word for younger listeners, their parents, or for anyone working with kids or teens. During growth spurts, bones are still developing. So the ends of some of these bones we've talked about today, like the femur and the tibia, contain areas called growth plates, which are soft spots of cartilage that are more vulnerable to stress. Repetitive strain during this stage, especially from jumping or poor technique, can cause conditions like Osgood-Schlatter disease, where the area just below the kneecap becomes painful and swollen due to overuse. So if you or someone you know is in that age range, it's especially important to respect your rest days, ease up on jumping a little bit during growth spurts, and then focus on having good form over intensity. All right, so let's recap. The knee joint is made up of 3 bones: the femur or thigh bone, the tibia or shin bone, and the patella, which is your kneecap. These bones work together with cartilage, ligaments, and muscles to create a smooth, powerful, and safe movement, if they're aligned and supported properly. So next time you're moving, whether it's in the studio, on the field, or just walking upstairs, check in with your knees. Is your thigh aligned with your shin? Can you feel your kneecap glide as you bend and straighten? Are your hips and feet helping your knees do their job? That kind of body awareness can make a huge difference, not just in how you move today, but in how well you move for years to come. In next week's episode, we'll build on this discussion of the knee by diving into the muscles, tendons, and ligaments that support the knee and how you can strengthen and train them for durability and power. Thank you for joining me today for the Ballet Science Podcast. Whether you are a dancer, teacher, student, or simply curious about the mechanics behind movement, I appreciate you being here today. Each week, we'll explore the intersection of science and ballet, from injury prevention and biomechanics to nutrition, mindset, and everything in between. If you enjoyed this episode, please follow this podcast, leave a review, and share it with your friends and dance community. If there are specific topics you'd like to hear about in future episodes, feel free to share them in the comments below. You can also follow Ballet Science on social media and visit our website at ballet.science for additional information. Thank you again for tuning in, and I look forward to seeing you next time on the Ballet Science Podcast.